Britain was once a beacon of social progress. The post-war era saw the birth of the welfare state, a safety net designed to protect its citizens from cradle to grave. Access to healthcare, education, and social security were considered fundamental rights, not privileges. This system, however imperfect, aimed to ensure a basic standard of living for all. Today, that legacy is fading. The UK is grappling with a cost of living crisis so profound that it is eroding the living standards of millions. The social contract that once bound the nation together feels increasingly frayed. Families who once felt secure are now struggling to put food on the table and keep a roof over their heads. The very fabric of society seems to be stretched to its breaking point. This crisis is not simply the result of global economic forces, it's a consequence of political choices made over decades. Austerity measures, implemented in the wake of the 2008 financial crash, have stripped away vital public services. Deregulation and privatization have eroded worker rights and driven up the cost of essential services. The safety net that once existed has been systematically dismantled, leaving the most vulnerable exposed to the harsh realities of the market. The cost of living crisis in the UK is not an abstract concept. It's the lived reality of millions who are feeling the pinch in their everyday lives. Inflation, which has soared to levels not seen in decades, is eating away at people's incomes. The cost of essentials like food and energy has skyrocketed, putting immense pressure on household budgets. Official figures paint a stark picture. In 2024, the price of food rose by 15%, with staples like milk, bread, and eggs seeing even steeper increases. Energy bills have become a source of anxiety for many, with gas and electricity prices doubling in some cases. Renters have also been hit hard, with average rents increasing significantly across the country. These rising costs are outstripping wage growth, meaning that even those in work are finding it harder to make ends meet. The impact of this crisis is felt most acutely by those on low incomes, pensioners, and families with children. Many are being forced to make impossible choices between heating their homes and feeding their families. The use of food banks has become tragically commonplace, a stark indicator of the level of hardship faced by many. The government's response, critics argue, has been inadequate, with measures like one-off payments failing to address the systemic issues at play. The dream of owning a home, once a cornerstone of British society, feels increasingly out of reach for many. The UK is in the midst of a housing crisis, characterised by soaring property prices, stagnant wages, and a chronic shortage of affordable homes. This crisis is not just about bricks and mortar. It's about the lack of security, stability, and opportunity that comes with having a place to call home. For aspiring homeowners, the barriers to entry have never been higher. House prices have risen at an alarming rate, far outpacing wage growth. The average house price in the UK is now many times the average salary, making it virtually impossible for many to save for a deposit, even with government schemes designed to help first-time buyers. The private rental sector, often the only option for those who can't afford to buy, offers little respite. Rents have been rising steadily, pushing many renters into poverty. The quality of rental accommodation is often poor, with tenants facing insecure tenancies and unscrupulous landlords. The lack of affordable housing has a ripple effect throughout society, contributing to homelessness, overcrowding, and a generation priced out of the areas where they grew up. While the cost of living spirals upwards, wages have stagnated for many. The gap between the richest and the poorest is widening, creating a two-tier society where those at the bottom are struggling to keep their heads above water. The rise of insecure work, characterized by zero-hour contracts, the gig economy, and a lack of employment rights, has exacerbated this problem. For many workers, the promise of a stable job with a decent wage and benefits has become a distant dream. They are trapped in a cycle of low-paid, insecure work, often juggling multiple jobs just to make ends meet. This lack of financial security has a profound impact on their lives, limiting their ability to plan for the future, save for retirement, or provide for their families. The government's focus on austerity measures has further eroded the bargaining power of workers. Cuts to public sector funding have led to job losses and pay freezes, while changes to employment law have made it more difficult for unions to protect their members. This weakening of worker protections has created a climate of fear and insecurity where many are afraid to speak out against unfair working conditions for fear of losing their jobs. Section 5. A healthcare system on the brink, the NHS in peril. The NHS, once the envy of the world, is now facing unprecedented challenges. Years of underfunding coupled with increasing demand have pushed the health service to its breaking point. Long waiting times for treatment, staff shortages and a lack of resources have become all too familiar. The COVID-19 pandemic exposed the fragility of the NHS, but the problems run far deeper than the immediate crisis. The pandemic placed immense strain on the NHS, leading to a backlog of cases and exacerbating existing problems. Waiting lists for routine operations have soared, leaving many in pain and distress. The mental health impact of the pandemic has also been significant, with demand for mental health services far outstripping supply. The government's response has been criticised as being too little, too late. While additional funding has been promised, it falls short of what is needed to address the systemic issues facing the NHS. The crisis in social care, which is inextricably linked to the NHS, further compounds the problem. A lack of funding for social care means that many people are stuck in hospital unnecessarily, taking up valuable beds and resources. The cost of living crisis is not just an economic crisis, it's a mental health crisis. The relentless pressure of making ends meet, coupled with the uncertainty and anxiety of the current climate, is taking a toll on the nation's mental well-being. From the stress of mounting bills to the despair of being unable to provide for their families, millions are struggling to cope. The link between financial hardship and mental health problems is well established. Poverty, debt, and unemployment are all significant risk factors for developing mental health conditions such as anxiety, depression, and even suicidal thoughts. The current crisis is pushing more and more people to the brink, with potentially devastating consequences. Despite the growing need for mental health support, access to services remains woefully inadequate. Years of underfunding have led to long waiting lists, a shortage of trained professionals, and a postcode lottery of care. This lack of access to timely and effective treatment has a devastating impact on individuals, families, and communities. In the face of this growing crisis, the British people are not remaining silent. Across the country, voices of dissent are growing louder as people demand action on the cost of living. From nurses striking for fair pay to renters protesting against exorbitant housing costs, a wave of activism is sweeping the nation. Trade unions, after years of declining membership, are experiencing a resurgence as workers recognise the collective power they hold. Strikes and protests have become increasingly common, with workers from various sectors demanding better pay, improved working conditions, and an end to the erosion of their rights. Community groups and grassroots organisations are also playing a vital role in supporting those most affected by the crisis. Food banks, once a rarity, have become a lifeline for many, providing essential supplies to families struggling to afford groceries. Mutual aid groups formed during the pandemic continue to offer support and solidarity, demonstrating the resilience and compassion of communities in times of hardship. Addressing the UK's cost of living crisis requires a multifaceted approach, one that tackles the root causes of inequality and poverty. Simply offering band-aid solutions will not suffice. What is needed is a fundamental shift in priorities, one that places the well-being of people at the heart of policy decisions. One crucial step is to address the housing crisis. Building more genuinely affordable homes, both for rent and purchase, is essential. This requires significant investment from the government, coupled with measures to curb speculation and control rents. Addressing the lack of security in the private rented sector through stronger tenant protections is also vital. Investing in public services, particularly the NHS and social care, is another critical step. This requires a commitment to long-term funding increases, not just short-term injections of cash. Addressing the staffing crisis in both sectors by improving pay and working conditions is essential to ensure that these vital services can meet the needs of the population. The UK's cost of living crisis is a stark reminder that we are at a crossroads. The choices we make now will determine the kind of society we want to live in. Will we continue down a path of widening inequality and social division, or will we choose to build a fairer, more just society for all? This is not just a matter for politicians to solve. It requires a collective effort from all of us. We must challenge the narrative that pits us against each other and instead embrace our shared humanity. We must demand better from our leaders, holding them accountable for the decisions that impact our lives. The challenges we face are daunting, but they are not insurmountable. By working together, we can create a future where everyone has the opportunity to thrive, not just survive. The time for complacency is over. The time for action is now.